Hey, Miss Asher, John Spangler, nice to see you. What brings you into urgent care today?
I am just in a lot of pain with my back.
I'm so sorry to hear that. I see in your chart you've been here several times, and at last visit they ordered an MRI, and those results are back, which we could talk about. Tell me precisely where is your pain?
My lower back and my legs.
Can you describe it to me in more detail?
Well, ever since my fall, it's been terrible, sharp, constant pain in my lower back. It radiates down my legs, causing my feet to burn and tingle, and it's really hard for me to do my job.
That sounds pretty miserable. Can you describe your fall for me?
A few months ago, I fell walking up my front steps when they were icy, so when I hit the ground, I hit really hard landing on my back.
What have you been doing for the pain since then?
Initially, I was taking high-dose ibuprofen, but it has hardly touched the pain. I had trouble moving one morning, so I took an oxycodone that my husband had left over from dental surgery.
I see. Well, how did that go?
Well, it took almost all the pain away for a few hours. I see a different doctor every visit, so they've given me a prescription of oxycodone for the past couple of months, along with seeing my regular provider as well.
Okay, so what kind of work do you do?
I'm a coffee shop manager downtown. I'm on my feet all day long, running back and forth with the supplies that we need to operate the business. I restock the shelves, and I also help unload shipment trucks each morning.
Well, so I know you're in a lot of pain, and I'm glad to share you good news about your MRI. It doesn't show any fracture or disc herniation or really any other damage from the fall.
But this pain is so terrible, though. It causes me not to be able to sleep at night or to get through the day. It's just not something a 28-year-old should be dealing with. There's got to be something stronger I can take than ibuprofen.
Well, we can add another medication called cyclobenzaprine, which can relax your muscles and may help ibuprofen do a better job.
Can I not just get oxycodone? I know that it works. The last doctor gave me oxycodone with ibuprofen that I took once oxycodone ran out. It just doesn't work like the oxy, not with my job demands.
Well, I know that does help you, but I'd rather not go the oxycodone route because opioids can be addictive. They have a long-term risk of dependency. They can cause side effects such as, withdrawal symptoms, diarrhea, headaches, and also they can cause serious side effects like stopping breathing.
Well, I definitely don't want to stop breathing, and I do understand the side effects. I don't believe that I'm at risk for addiction because I'm only using this medication to relieve my pain. It's the only thing that works.
All right, well, before we go further, I'd like you to fill out this questionnaire. It's called the DAST-10, and it gives me a better understanding of your risk level from your oxycodone use.
I'll do whatever you ask as long as it makes me able to get the oxy.
All right, so let's look together at your DAST-10 result. You score a 6, and that means a moderate level of risk for opioid addiction.
Well, I think it's necessary for the pain.
All right, well, how much do you typically take of oxycodone in a day to help with your pain?
I would say anywhere between 6 and 8 pills.
Do you ever take less than that?
Well, if I take less than that, I feel terrible. I get pounding headaches. I feel sick. I'm sweaty. I'm not able to do my job or move around.
It sounds like your body's actually developed dependence on the oxycodone. The headaches and sickness that you're describing, those are actually withdrawal symptoms. Would you be willing to talk about coming off the oxycodone so that we can get you on a better path to feeling better?
Well, I'm really just concerned about how I'm going to feel without taking it. The feelings I get without it are really hard to bear, so maybe I've become dependent. I did have an employee several years ago addicted to street drugs that we didn't know about, so I understand that this can happen. I never really thought it would be me. I would never resort to getting oxy illegally.
Okay, well, there are some options we can use to get your pain under control with a different medication and even other treatments like physical therapy or alternative treatments like acupuncture. Would you consider any of these?
Maybe. They just sound really time consuming.
Well, I would like you to strongly consider also an outpatient program that we have that uses a medication called buprenorphine, also known as Suboxone, and it can help people with withdrawal symptoms when they stop the oxycodone. The buprenorphine then can be titrated down. It's really effective, but it's most effective if you combine it with counseling. Would you be willing to try that?
I don't know. I've never considered that I had an addiction to oxycodone. Maybe I do. I'm not convinced. My husband does not know anything about my oxy use, so I kind of need to talk to him.
I know in a short visit it's hard to get your mind wrapped around addiction and dependence. On a scale of 0 to 10, with 10 being absolutely willing today, where are you in terms of being willing to stop oxycodone?
Right now, without knowing all the details, probably just a 3.
Okay, so why a 3 and not a higher number like a 4 or a 5?
Well, I mean, right now I'm managing my pain well with the oxycodone, so I'm skeptic that anything else is going to work. Treatment's going to be time consuming, and I've got to think about my job, and I'm really just tired of coming in and hoping that the provider's going to prescribe me oxycodone. So you'd kind of have to convince me to be higher than a 3.
You're not going to be able to keep getting oxycodone prescriptions from our clinic. It's really only meant for short-term pain. However, I'd like you to consider our treatment program that can help you with your withdrawal symptoms as you come off the oxycodone.
So what would you be suggesting?
Well, there are options for working people and actually even treatment programs. I know it seems a lot to comprehend with addiction and dependence, but people do recover and they can get their pain under control even without opioids. I'll get some information for you on the Suboxone Clinic. I think it would be helpful also if you talk to your husband and bring him in with you next appointment.
I'll talk to my husband because I am concerned and honestly a little scared that now I'm being considered an addict.
Okay, I'll get information together and set up the Suboxone Clinic. I'll put together some medications to manage your pain, and I'll see you back in 6 weeks.
Okay, thanks.
This case exemplifies a patient that many of us see in clinic seeking help with her ongoing pain, which has been relieved by opioids, oxycodone in her case. She's in denial about her opioid addiction. Providers often encounter patients like this that seek opioids, and they have legitimate pain. What's challenging about this patient is that she has been treating herself for the pain, and she's already recognized that it helps her. And she's also using the urgent care clinic setting to see multiple providers, which allows her, of course, to get additional refills with someone that she had not seen before. The strengths of this scenario, though, I think, are the fact that there was adequate rapport building. It could have gone a little bit more in detail. And the provider also did a good job recognizing that the patient had feelings about withdrawal symptoms and told her that those actually were withdrawal symptoms. Some weaknesses, though, on the other hand, the provider failed to really explain risks in detail when the patient said, "I don't fall into that risk for addiction." The provider also appeared to gloss over the risks associated with opioid misuse and set up a follow-up appointment really too long in the future, 6 weeks, even though the provider also was going to set up a Suboxone visit. There were some omissions, of course, in this scenario. The provider really didn't ask permission to talk about opioid misuse and to go over with her also the results of the DAST-10, nor did the provider check the North Carolina Controlled Substances Reporting System. In terms of missed opportunities, the provider does not address the patient's concern about how time-consuming treatment will be. She's a coffee shop manager, and she would have to take time out, and the provider really didn't go into details about how there may be ways to work around that, although the provider did say there are programs for working people. This could have just been gone into a little bit more. The provider also didn't ask why the patient hasn't told her husband about this. So the provider really should acknowledge the fact that her husband doesn't know about it, and comment on that and acknowledge that the patient may be afraid to talk about that. The provider also should emphasize that using multiple doctors in the urgent care setting is no longer acceptable. That we see this a lot, of course, in clinic, where a patient will come in and see multiple doctors instead of working through his or her primary care provider to get controlled substances.